Right now, we're in Lung Cancer Awareness Month. If you didn't know, a time to highlight prevention, treatment, and of course, survivors. Here to discuss the current rise in lung cancer in non-smokers and how to combat it is Dr. Marcus Eby, a thoracic surgeon with Tampa General Hospital Cancer Institute in the Palm Beaches. Doctor, thank you so much for being here.
Thank you for having me.
Of course, this is the leading cause of cancer death when we talk about all cancers.
Correct.
So people hear about lung cancer, they say they do not smoke, I'm safe from this. Talk about that assumption out there.
Well, of course, smoking is a risk factor for getting lung cancer, but it's not the only reason someone can get lung cancer. There's a lot of different occupational exposures, environmental hazards that people aren't aware of that can cause lung cancer.
What do you think is, what do you see as contributing to the rise in lung cancer, the most important thing that we're seeing?
Common ones that people are aware of course, secondhand smoke. They're not smoking themselves, but they're exposed to it. A lesser one that people aren't aware of, but is the most common, is actually radon exposure. Radon exposure is a naturally occurring gas that occurs in the earth. It comes up from the earth and it goes into the buildings that we live, and we inhale it. So our lungs are like a filter, and even though we're not actively smoking, we inhale the radon and it causes damage to our lungs, which can result in lung cancer.
And so if I have it in my family, are genetics a contributing factor?
Yeah, genetics are definitely a contributing factor. We see in our patient population, if you have a family history of lung cancer, that does also increase your risk of getting lung cancer, even if you're not a smoker.
Let's talk about some of those occupational hazards you talked about earlier. If I'm on a certain job, what should I be looking to do to prevent my risk?
Of course, making sure you wear some protective equipment for any inhalation issues. A well-known one historically is asbestos, but even things such as diesel and anything on we have firefighters in our patient population that we need to protect, and making sure that they cover their lungs for inhalation injury. So just working with your team to make sure you have the right equipment.
And what are some signs I should look out for that are signs of lung cancer specifically?
I would definitely make sure you consult with one of your primary care doctors or a physician in the community if you're having an ongoing cough that doesn't get better in time. Of course, unfortunately, if you're coughing up any sort of blood, that would be a highly concerning issue. Or if you have these exposures, it's better to consult a doctor sooner than later just to make sure we catch something early.
Sure, and speaking of that, I think when men, for example, think about prostate cancer, getting screened is so important because sometimes they don't even know they have it.
Correct.
Is that the similar thing with lung cancer, or do you really know when you have those symptoms?
Very similar with lung cancer, where you don't have symptoms. Everybody's aware of getting mammograms, colonoscopies, skin checks living in South Florida. Less commonly, they're not aware that we should get screened for lung cancer as well. And a lot of the times when it's a smaller lung nodule, there's no symptoms associated at all. So the imaging is very important to obtain early on, because unfortunately, far too often, I have patients where the lung cancer has progressed and we're not able to surgically remove it for a cure. The best part of my job is to be able to cure someone of lung cancer, and that's if you catch it early.
Perfect. All right. And men, women, you see it across the spectrum?
Globally we see that it can affect both men and women equally.
All right, doctor, appreciate that. Thank you for keeping us informed here on this Lung Cancer Awareness Month. If you're listening to this and want more information, just head over to our website, WPBF.com, to learn more about lung cancer and, of course, the hospital system as well. Nathalie?
Stephen,